to this latest episode of Inside the Doctor's Lounge. And I'm your host, Dr. Desmond Bell, with my colleagues, Drs. Randy Cook, Rick Zollinger, and Rhonda Crow, the CEO of MD Coaches. So you've probably already gotten a little glimpse of what goes on in here. And if you've ever been inside a doctor's lounge, you know it's a safe place where we can have discussions on any number of topics, whether it be serious, whether it be fun, whether we're talking about patient care or anything that really kind of crosses our minds. So, with that, over the past couple of days, I got to thinking myself about where I've come over the past several months in particular. And I found myself at a crossroads in my career. And that kind of spurred us to discuss a little bit amongst ourselves about doctors at the crossroads and what happens, where you start out in your journey in medicine and where it takes you. And so much of it is really kind of out of our control. We just kind of get ourselves set for the tasks at hand, but how it all unfolds really is kind of fascinating. I know the four people in front of you all have different stories to tell. And so, with that, I just kind of wanted to open up to you guys. Here we are, so many of our colleagues are wrestling with, a lot of angst over what's happening in medicine now. Forget about what's happening in society, but just looking what's happening in medicine, it certainly has changed so much over the course of my career. There was once a time where being a physician meant certain credibility and maybe even certain level of comfort, respect that came with it. What really kind of triggered this in my mind was a colleague of mine who is an interventional cardiologist, and really he's well-renowned. He's world-renowned, I should say. Highly respected, incredible physician, has done more for limb preservation than most. And he threw something out on social media a couple weeks ago that I was just blown away that he threw it out there. And that was, he was asking for recommendations as far as an MBA program. It's like, why would a guy who's young in the prime of his career be looking to go on to get an MBA? What is wrong with this picture? This is so, kind of outside of where, when I was coming up as a kid, where you would place a physician. They pretty much, if you got into medical school back in the 70s, that was sort of your golden ticket in a sense. And you were on your way. You had, really the world was your oyster, and you had a chance to live out your dream, but also, all the good things that go with medicine, intellectual curiosity, problem solving, all these things. So to see somebody so well trained and such a leader in the field be looking to move over to maybe an administrative side or trying to understand the business of medicine, it made me think, he's not the only one. I've encountered at least 4 other people in the past year who have made similar decisions, and myself included. It's not like I've gone off seeking to get out of medicine. That's another area that we'll discuss. But why are we at this point? Do you guys have any thoughts on this at all? Because it's really, I think it's more of a symptom than is it dissatisfaction with medicine? Is it something that they are personally, they're just overachievers and they just want to continue to learn, whether to go off and get an MBA or a legal degree, let's say, because we've known people like that. But anyway, that's my kind of little setting it up or teeing it up for you guys today. And so I just want to hear your thoughts.
Well, I had a thought of one thing, and Randy, you'll get into this one too, is I always kept my general surgery boards. I never practiced general surgery. I practiced thoracic and cardiovascular, but I always kept my general surgery boards. I would never let the 10-year lapse. I kept my thoracic boards, and then I got boarded in hyperbarics. So I had 3 boards. And it was the hardest thing to let those go finally, to say, okay, what's the point in going back and doing my general surgery boards again? And it's that thing that doctors have about not letting go of. We put a lot of time and work into becoming what we are and developing these skills. And then you hate to release those. People in business they'll say people in a great career might have 5 to 10 jobs, and we have one. And it's not surprising that we get to 50 or 55 or whatever, and we go, is this all there is? Is there, my kids are living well, but I'm not home, or, so you start to look, and I look at friends and they're doing other things. And I think for me personally, it was just thrust on me. I just kind of happened to walk in the right door at the right time. Like with this, Randy calls me, says, Rhonda's got a company. I started taking an online course. Then we started doing videos, and it's just developed into something that's, I'm hanging out with you guys. It's just great fun. I mean, I look forward to this. So, getting into podcasting, all this goofy, nothing to do with making a living. It's just making a life.
Yeah, you touched on something too, Rick, is that, okay, do I let this stuff go? And letting go is part of it too, when you're at that crossroads and you're moving on to the next phase of your career. I mean, 6 months ago, I finally stepped away from clinical practice. Now, the wheels had been in motion for a while, and I, was like you. It's like, do I do this? Do I not? Do I stay in it and practice part-time? But you finally realize that stuff's holding you back. And you have to, it's not a leap of faith, but you've done all your research. You've examined the reasons why it's time to move on. And when I finally did make that decision too, I was excited. I couldn't wait to kind of get on to the next step because I had several things lined up. And here I am. And like this was not a conscious decision initially to go back and get a traditional type advanced degree, like a legal degree or MBA. Circumstances happen. You said it was thrust upon you. Things presented themselves to me, and I found it, okay, it's time. You got to pay attention to some of the little road signs that pop up along the way too. And then you embrace them and you go with it. And in the back of my mind, I said, yeah, I can always go back if I want, but will that happen? I don't know. It may take on another form. Mentoring is important to me. So that's why I'm doing, with you guys. I love the idea of helping others, especially, physicians who are coming up, or even some of our colleagues who maybe are in the same age group too, who might be wrestling with similar ideas. So good, Dr. Cook. I know you got those wheels are turning, and I see smoke coming out of your headphones there behind.
You can hear the rust. I guess you.
No rust in there, man. None at all.
Des, this one's kind of hard for me. I think, like most things, it's not a one size fits all. I was thinking about the person that you described who sounds like is, relatively speaking, young-ish, and yet is just absolutely at the top of the game. And I think for people who fit that description, they are in a particular class. I think it was, boy, I may get burned on this one. I think it was Alexander the Great that wept because there were no more worlds to conquer.
Well, yeah.
And if you are so good at a thing that it's really not a challenge anymore, then I can certainly understand the need to look around and see what might be available. But what really disturbs me the most within what I see in physicians is people who are looking for a way to get out, not because they feel like they've done all that they can do, but I feel like they don't think that they are being rewarded, particularly emotionally, in the way that they thought they would when they started on that journey. I mean, most people, and certainly not all, but I think most people who get into the healing arts do so because they have a sense of altruism and the need to give, the need to contribute. And it changed in the 44 years that I practiced. I can tell you that fighting the bureaucracy became much more difficult than fighting disease. And for a lot of people, they get to a point where they just don't see the point. They're not, they're losing against the bureaucracy. They don't think they can win against disease, and it's time to move along someplace else. And that's the thing that really worries me the most about where we are at this point.
Well, you made me think of something too. I think if you look at overall happiness, personal happiness too, you describe somebody, when I was talking about my colleague there, yeah, he's a high achiever. He's done this. And maybe you're right. I mean, I sense that he probably is just such a bright guy and just wants to move on and personal development. That's really what at the bottom of it. I think it's when the guys who go for just trying to they think that they need to move on to like take a degree just because it'll be a way out. They're still going to be disillusioned when they get to that point.
Exactly.
And I think it's the people that will, just kind of pursue, goals, personal things that they're interested in.
I think
there's a difference.
I think that's a different process, though. I even thought about doing that at one point when I first walked away from the surgery. And I'm the guy Randy was talking about. I'm probably an early leader of that kind of movement. I wasn't doing it because I wanted to get another degree and become an administrator and keep going on in my career. I kind of just stopped my feet, threw a little hissy fit, and walked away, like Randy was saying. And then once I had,
I'm shocked. You're usually so emotionally stable.
Oh yeah, well I'm not. So yeah, so then after, and this is where one of the things about coaching, I feel like that depending on your specialty and any specialty, it ought to be built in that you have a built-in sabbatical. And for me, after I'd been away 6 months, I was ready. I could have gone back, but I didn't have any place to go without moving to another city, which I wasn't going to do. And I fully believe there's a neurosurgical group in town that makes their doctors take a full, whatever that is, 9 days every 6 weeks. You absolutely are off for 9 days. And during that time, you're not allowed to do anything medical. You're supposed to go, do art, music, or whatever. But I think that having a built-in getaway for people should be every 5 years, whatever, something. That's just one little tip I would bring that I thought would be useful. But I would have loved to have had that. If I had had that, I think I might have made it to the age I am now and still been practicing.
I think that's a great idea, and it underscores how things have changed for everybody. I reflect many times on the reality that when the Social Security Act was signed in 1935, average life expectancy for males, who were by and away the significant beneficiaries of Social Security, was around 67, and now it's almost 80. So the notion that you can continue to be fulfilled doing the same thing 7 days a week is something that I think we can all agree is not healthy. And if we're going to work for 4 decades, 5 decades, we probably ought to build something into it that gives us an opportunity to reflect on the reality that there are other things about life that we should be taking advantage of, because I don't think anybody can be totally fulfilled by going to work every single day.
Right.
No. We're all intellectually curious by nature, and it doesn't matter. That's just people in general, some more so than others. But we have this opportunity to take a step back, and what you're describing, I think it's a great idea. Everybody should have that opportunity to kind of just reflect, just take a little time, and you recharge too. But it makes you a better physician if you do. First of all, you see things from a different perspective. You're happier, without question, because you've had to put everything else on hold for so long. Everything else is put ahead of you in a sense. Your patients, your family, your career, all these things just take precedence. And so often we don't look at it, at taking better care of ourselves. So I think that's so important.
Remember my story about first in wound care where I had the patient that came in the go-kart and had wounds everywhere and swollen legs, and I was going to cure him. I'd just come back from Jackson or Houston back then, and I was going to do hyperbaric. I was going to cure the world. And then after about 2 months of taking care of this gentleman, I realized, you can't do it like you used to do it. You have to see it from his perspective and live, life. And this man his life was doctor 5 days a week and wound care once a week, his dialysis 3 times a week. All he did was get on a bus and go to a doctor. It was awful. So I finally learned to treat him with that respect. Anyways, my point to that was I got some insight into, instead of just being a doctor that comes in and says, there's more to life than curing everything, So that patient will stick in my mind forever because he was, it woke up something inside me besides.
Good lesson.
Yeah, and the importance of a holistic approach to
the person
managing a patient, the wound. It's not just a wound we're looking at.
Yeah.
There's so much more to it. And,
from my observation, there is that element of dissatisfaction and disillusionment. I've had my fair share of discussions with physicians to that end. But, thinking about your friend who's going back to get his MBA, maybe I lean a little bit more so in this situation that it's preparation. It could be that I need to be challenged more and I need to learn more. Let's face it, healthcare is a business. It's been brought to us that is very much so a business. I see more and more of this happening. And at first I thought it was, and I do think there's that element of, I need to reinvent myself because I am not satisfied. I'm not being fulfilled. But I think there's a rise in an understanding of I need to equip myself. I need to strengthen my voice. I need to participate more. I need to engage more. In order to do so, I need to have the knowledge. And so I got to go out and get it. And as you state, physicians are very curious and they seek and they are action oriented. And so it's not very surprising. And it very well could be that that's what your friend may be doing, is equipping themselves for what they're being observant of what's going on around them.
Yeah, and we feel like commodities. So who's making the decisions that affect us? Well, the administrators. Mm-hmm. Well, if you were a physician and you now have that insight by way of an MBA, let's say, now you have one up on them again, in a sense. If you think about it, now you add the perspective of being somebody who's been in clinical practice and understand it from that perspective too. It's kind of like, Rick, what you're talking about, your patient. It's like you saw things from his perspective. Now it changed things. And so, yeah, I've thought about going back too. I have to admit, several years back, I started looking at programs, and it was just, it might be just something I need to do, and because I don't know enough about business. And whether it was for survival, it wasn't for something to get ahead, but it just to just understand more. That was my motivation.
Well, Rhonda, did you were an example of doing the MBA as part of your growth, correct? I mean, You didn't go get an MBA because you hated nursing.
No, I'll tell you why I went back to get an MBA, and it was exactly what I just articulated. And it didn't take me very long either. Doing bedside nursing, I found out very quickly that I not only needed clinical language, I needed business language to be able to communicate with my administrators and to really understand what was motivating their discussions, their actions, their decisions, so that I could have maybe a voice at that table and influence. You got to be able to speak the language.
Well, I'm going to have to tell you, and I understand exactly what you're talking about, but Rhonda, I got to tell you, I think that's a little sad because it sounds like the pursuit of the MBA was a defensive move. You were being controlled by people who spoke a language that you didn't understand. And I think that maybe that's the next topic for the Doctor's Lounge. And that is that we are being led by people don't have the faintest idea what we do.
You
And yet
know,
you thought it was important to understand
yeah.
what they do. Is
Without
anybody
question.
thinking about us?
There
Without
you go.
question.
Awesome point, Randy.
Felt
Yeah,
I
that's a
needed
good
to, I needed to understand, and I didn't want to have it taught to me in someone else's lens. I wanted to go, and I wanted
Sure.
to go and get the MBA, which then allowed me to be, it allowed me to level the playing field.
Yes.
And
And
I think that's
I
what
don't,
you were saying, Des.
yeah, I don't mean the comment to be critical
Oh, no.
at all. It is a clear sign that you felt there was a communication gap between you and the people that you worked for. And that is a very unfortunate thing. And I think it's a good sign that they're, if this is the way it's going to be, and clearly it is, then it's probably a good idea that many of us, or a lot of us, are going to take the same step that you did. Because if healthcare organizations are going to be led by physicians and other healthcare professionals, they're going to have to learn to speak the language.
Well, I think
No,
that's a
that-
little bit what you're saying, and that's my observation is I don't think it's all that. I think there's a great deal of disillusionment, but I think there is a current change of I'm going to equip myself.
Just made me think of something. How long before we have dual MD, MBA programs?
Oh, it's already there.
It's already
Yeah,
there.
it
There's
is.
MD, JD
Yeah.
too.
Wake Forest, I know when I was applying for medical school, Wake Forest was already offering the dual degree. It didn't really catch fire, but I think it might soon.
Well, in the Northeast, they had a big one that the old Hahnemann and Wharton had one. I think it was Hahnemann, or maybe in Penn, I don't know. But they had a combined MD MBA that was a big deal because Wharton was so famous.
Sure.
Interesting.
Yeah.
It could have been Penn. Yeah, that makes sense.
I was thinking about something else, Randy, that you said when you said that they don't understand us. My first impression of that is when they came in, late 90s, early 2000s, and did care plans.
Yeah.
So they started trying to get us, for example, with coronary artery bypass, they wanted you to have your patients home in 3 days.
Right.
We've been keeping them 7 to 10 days, I mean,
Mhm.
and we got to that point where we were sending people home, and it made you very uncomfortable because they were practicing medicine, not me.
They picked the discharge date.
Yeah.
Yeah.
And then the way they said we'll deal with you as physicians is we'll put Rhonda over you. So she is an RN and so we'll have a clinical case manager who will then tell the doctor what to do.
Yeah.
And it was like, well, that would be fine if Rhonda was working with me, but she really wasn't. She was working with the guy up there.
Talk about creating an adversarial relationship right out of the chute too.
Yeah.
Nothing personal.
I will tell you, I've been in that situation and I have had more than my fair share of C-suite arguments that you, my doctor, did not know about. And that was in
No
defense
doubt.
of you.
No, I'm not surprised to hear this.
Yeah.
Yeah, it got uncomfortable a few days.
Yeah.
Well, listen, guys, I think we're kind of running I'm looking at the clock and I think, we probably had our cups of coffee now. We've been able to kind of touch on some important subjects today, including my shirt.
Yeah, that's a nice shirt.
I like
We're going to start. Your nickname's going to be Des Charlie, but,
I was going to say, I'm your host, Charlie Sheen. No, anyway, I hope that, for our viewers and people who have tuned into MD coaches and in particular inside the Doctor's Lounge, this provoked some good thoughts for you. And, I just kind of wanted to end it in one way. Again, we talked about the journey and personal fulfillment and intellectual curiosity and any number of topics relating to, being at the crossroads. So whatever you do, sometimes things do present to you. Other times they're actively sought out. But, the bottom line is whatever you do, it requires some good thought and reflection and, try and be happy in the pursuit of it. Life, liberty, and the pursuit of happiness were never truer in a case like this. So, in times like this, we're here for each other. We hope that you'll subscribe to our Inside the Doctor's Lounge broadcast, podcast, videocast, whatever it calls. I'm dating myself now, but I'm lucky each week now to be able to share some ideas with my colleagues and good friends here. So until next time, I'm Dr. Desmond Bell with my colleagues, Drs. Randy Cook, Dr. Rick Zollinger, and Rhonda Crow. We'll see you next time inside the Doctor's Lounge.
Next time.
Sounds good.
Good one.
Life is certainly a journey full of all sorts of unexpected twists and turns. And a career in medicine is no different for sure. Where we start and where we get to along the way, so much of it is truly out of our hands. Today's topic, Inside the Doctor's Lounge, tried to address that. Doctors at the crossroads. Our colleagues, Drs. Randy Cook, Rick Zollinger, Rhonda Crow, and I have all been through our own personal journeys, and we hope that the things that we talked about today maybe triggered some ideas. If you find yourself at a particular crossroads, maybe you're contemplating going for an advanced degree such as an MBA or a JD, maybe you've got other opportunities that are presenting to you. Know that you're not the first and you certainly won't be the last, but the bottom line is you've got to pursue that thing that makes you happiest. Medicine can really be all-encompassing, as you know. So to have the opportunities, that present themselves, really take advantage of them. Life will provide you with some little markers along the way, little road signs, if you will. So you got to pay attention, but at the same time, you've also got to enjoy. So we hope that you've enjoyed this latest episode of Inside the Doctor's Lounge. It's a place where we can talk freely about any number of topics or ideas, and we want you to continue to join us. Hopefully you'll have some ideas that we'll discuss, and please submit them to us. You may find yourself being invited to be one of our guests in the future. Until then, for Inside the Doctor's Lounge and MD Coaches, I'm Dr. Desmond Bell. Remember that we see you, we're here for you, and we believe in you. Until next time.